Hey everyone, Dr. Ellie here with part two of From Milk to Munching, a holistic guide to starting solids. If you haven't listened to episode one, go ahead and click on that first, and then come right back over here to part two of From Milk to Munching. Hey everyone, Dr. Ellie here with another podcast. My practice is Middle Path Integrative Pediatrics. I'm located in Asheville, North Carolina. And if you have kiddos 0 to 21 who need a pediatrician and you're looking for a holistic pediatrician, then I can help you. I also do functional medicine consults for kiddos aged 2 to 102. So if you're in need of help with anything in that realm, I can also help you with that. This episode is actually inspired by my members, who many of them are either starting solids now or going to be starting solids soon. And so I wanted to bring this episode to you guys so that you would know how to do that and do it holistically. So I'm naming this episode From Milk to Munching, which I think is just adorable, a holistic guide to starting solids. So bear with me as we work through all of that. What to not feed your baby. Okay, so don't feed your baby something that's raw or undercooked because you could expose them to like a foodborne illness. So, no like sushi or like undercooked meat, flour that hasn't been cooked, something like that. You don't want to give them an infection, like a gut infection. Hopefully that goes without saying, but just to reemphasize, don't use like French fries as a finger food, or I'm not going to be mad if you gave your baby a puff here and there, but it's not like the best food. It's not super nutrient dense. We want to try and avoid that kind of stuff. So processed food in general, anything with sugar and salt. Salt, it's just too much on the baby's kidneys. The kidneys are not fully developed yet. So we just want to avoid salt for that reason. And then sugar, it's super bad for their teeth. I've heard once or twice people kind of say like, oh, well, they'll lose those teeth, so it doesn't like quote unquote matter. That's actually not true, because there's a lot of evidence to show that the dental decay, and I'm not a dentist, but from what I understand, the dental decay of those primary teeth, the first teeth, will actually can lead to like worse teeth later on. Also, sugar in general is really bad for us for other reasons. I mean, heart disease, diabetes, metabolic syndrome, all liver problems. There's like a list that goes on and on. So let's not start that as a first food. Let's try and avoid sugar. I know everyone has a grandma out there that has given their baby like a lick of frosting or something, but in general, let's try to avoid that. Okay, hot dogs and meat sticks. This is a choking hazard, so let's just not do hot dogs and meat sticks. We don't want your baby to choke. And again, like that's really any like chunk of food. Like if you're giving them like a big old chunk of cheese or raw fruit, they could choke. Same for like whole nuts or whole seeds. They just can't really like swallow those well, and that could be a choking risk. Same with popcorn or whole grapes, that haven't been cut in half. And that's not really a first food, but that's something you may do later on anyway. Again, candy. Please stay away from giving your baby candy as a first food. Sometimes I know it's like cute to see them like get happy that they have sugar, but it's just so bad for health. So as much as you possibly can, like please avoid all of that. Honey. Okay, I have a special note on honey. So honey actually can contain spores, which are basically like little precursor germs. Honey in particular can contain something called Clostridium botulinum bacteria, and that can cause infant botulism, which is super bad, you guys. Like botulism is not something you want to be dealing with at all. This is a very serious condition. It can lead to muscle weakness, problems breathing, and a lot of other complications. And this is because of the immature digestive system of infants. They really just don't do well with honey because of it can contain this botulism spore. So just please make sure you're not doing honey until over a year old. Okay. Cow milk and milk substitutes. I get this question a lot because I think it's confusing, especially with the new allergen guidelines, which we're going to talk about later. The thing is, we're trying to avoid giving cow milk and milk substitutes as like a primary source of nutrition. So, it's not so much because of like an allergy or something like that, unless your baby has like milk protein allergy, which is a totally different topic. But like, they're just not getting the nutrients that they need from those. So if you gave your baby like one sip of almond milk or something, would I be super mad about that? No. But like if you're giving your baby almond milk instead of formula or breast milk, they're just not going to like get the nutrition they need. So we just want to avoid doing that. And the same for like the mammal milks. So let's just stick with breast milk and baby formula. Okay. Fermented foods. Okay. I love this topic. This is super uber holistic. So many reasons we want to give fermented foods, but let's just talk about gut. So, we want a healthy gut microbiome. So we want all those good bacteria that live in the gut to still live there. And we want the bad bacteria to be kind of crowded out. And one way we can do that is use fermented foods. And you want to do it around 6 to 9 months of age. I usually recommend it like start some solids, have your baby kind of going on, a good plan for a while. And once you get comfortable, then, you can maybe start adding in some of the fermented foods. So generally, I find that most of my patients is around like the 9-month mark when they're doing this. But if it was a little bit sooner, that would be okay. Unless your baby is having some massive immune deficiency or something like that, then I would talk to your pediatrician about that. Okay, so what foods do we start and what foods do we avoid when it comes to fermented foods? One food I do strongly avoid when I introduce fermented foods to babies would be kombucha. And that's because of the alcohol content, the sugar content, and potentially too caffeine. So sometimes there can be caffeine in kombucha. So avoid that one. Let me jump back actually. Let's talk about the benefits of fermented food a little bit more. So I kind of touched on it. I got excited and I didn't give you all the information. So here we go. So benefits are, it can support gut health by providing probiotics, which are the healthy bacteria. It can aid digestion because we're diversifying the microbiome. And it helps accustom your baby to really distinct, weird flavors. I say weird in quotes because I actually love these flavors, but some people it's a little bit outside their comfort zone. So they may consider it a little bit weird. But it really helps their baby to learn that different kinds of flavors can taste good, and it can encourage them to have a lifetime of enjoying nutrient-dense foods. So how do you even introduce fermented foods? Well, you can do something simple like just mix a teaspoon in with a familiar food. For example, like, I never know how to say this. If anyone knows, send me a DM or something, but kefir or kefir, the people who invented this, please tell me. But whatever that food is, Kefir, just add like a little bit into a mashed banana. Okay, so that's a great fermented food. Blend a little bit of sauerkraut, a little bit of juice into like an avocado puree. You could add some yogurt into some pureed fruit, or you can just offer the fermented food itself just to kind of normalize the taste. And examples of like baby-friendly fermented food would be just like plain yogurt, the kefir or kefir, or however you say it. Again, the sauerkraut, the kimchi, mild, obviously. You're not going to want to do like super spicy kimchi for your baby because I'm thinking they're not going to be too happy. Their tummy sure won't. And then fermented veggies can be good too, like carrots, green beans, cucumbers. Miso, I love because it's so easy to blend into like puree or broth or other foods. And then tempeh, of course, you need to soften it and mash it. That can be great too. And by the way, if you as a parent, caregiver, guardian have not introduced these into your diet, definitely do so because it will improve your gut health quite a bit. And your baby will learn that you're eating the food too, so they'll know that it's normal. Let's talk just briefly about liquids. So I get this question all the time about liquids. Water. Okay, so babies get all the hydration that they need from either breast milk or formula. But if they seem extra thirsty, it's like super dry out, it's winter like it is here. I don't know. They just look like they need a little more liquid for some reason. You could feed your baby water around 6 months old, but not that much. It's like a half a cup to a cup a day. So 4 to 8 ounces for a 6 to 12 month old. So minimal amounts, but if you needed to. All right, juice. Really strongly recommend avoiding juice. So juice is super sugary in general, especially fruit juices, and they don't have much fiber. So that makes the sugar content look to the body like it's super high. And in general, this can stimulate the body to produce like a lot of insulin, and this can cause a lot of other health issues. So We really want to avoid high sugar in general, and juice is one of those foods that just has a lot of sugar. To get vitamins and nutrients, I really prefer that you guys just do like a pureed, like whole fruit. And that way you're getting the fiber with that juice and all those minerals and all the goodies all in one. Plus your kid's going to be happier and more full. So that's a benefit as well. Soda. I'm putting this in here because I see this more often than I want to. And you guys, just never feed your kids soda. Soda is so bad for you. I mean, it's bad for your teeth. It's bad for your body. It can increase the risk of diabetes, of heart disease, of kidney disease, non-alcoholic liver disease. It's, high in sugar. There's no nutrients. It can even give you like gout, which, is terrible. And it affects memory and motor coordination. So like, who wants that for their baby? No, we want our babies to have good memory. We want them to have good motor coordination. We don't want them getting diabetes. We don't want them getting heart disease, kidney disease, liver disease. Let's just agree as a community that we are not feeding our kids soda if we want them to be optimally healthy, because it's just not a good choice. And there's so many other good, yummy foods out there. I promise there are. Okay. Enough of that. Preaching on soda. All right, let's talk about baby poop. So baby poops, they are going to change after starting solids. So, just expect that. They're going to change after starting solids. Generally, they become more variable in color. So you're seeing more strange colors because of the added, fats and other nutrients. They can have a stronger odor. So that's, something to know. Also, if you're introducing like green vegetables or green peas, sometimes that can make the poop like a deep green. And also, by the way, just so this doesn't freak you out too much and you think it's blood, if you gave your baby a beet, like a pureed beet, that can change their poop to make it red. So don't let that freak you out. It also can make their pee red too. So it may not actually be blood if you see that and you gave them beets, okay? If you didn't strain the baby food, which honestly, like who really has a lot of time for straining, but maybe you're super meticulous and you're straining all the food. Anyway, if you're not straining the food, this poop may actually contain like undigested pieces of food, especially like hulled pieces, like the outside of the pea or the outside of the little corn, skins of tomatoes, like that kind of thing. You're going to see that. That's totally normal. So don't let that freak you out and be like, oh my gosh, my baby's like not digesting food, right? That's completely normal. Things that you want to tell your pediatrician, if you see red, unless you like fed your baby beets right then, that was like the only time you've seen it, you want to let your pediatrician know, just in case, God forbid, it's blood. And there could be like reasons that, something's irritating your baby's digestive system or their little, anal area, or like they've got a little cut on their butt or something like that. You just want to let your pediatrician know that you saw red. Black poop is the same. So black, we take a photo, show your pediatrician, because we just want to know, if you are seeing black, we want to make sure that that's not blood too, because that can be blood from higher in the digestive system. So we just want to make sure that there's not a reason that we're seeing that. And then very white, like very pale poop too, that can sometimes be problematic. Usually if we're seeing that in the first 1 to 2 months of life, that's when we're most worried, but occasionally it can happen later on. But just let your pediatrician know so you can have a discussion about it and see if it's, something to be worried about or not. Okay, allergenic foods. So this has changed so much since I started being a pediatrician. Oh my gosh, has it been 17 years? I think it's been 17 years. That's so wild to me. That blows my mind. Okay. Anyway, this has changed so much. So if you're having a baby for the first time and your mom is telling you like you have to wait to introduce allergenic foods until like 2 years old or something like that, yes, that's what we told people. And guess what? It was completely wrong. So don't wait to be introducing allergenic foods. We want to be introducing allergenic foods way sooner than that. So in general, we do want to do that around that 6-month mark. And why is this important? Okay, so food allergies do affect about like 8% of kids in the US. If you think about like a kid's classroom, and let's say there's 26 kids in your elementary school classroom, which would be great for a lot of teachers, nowadays. But let's say there's 26. As many as like 2 of those 26, 1 in 13 kids could have, a food allergy. So we really want to avoid that because food allergies can be really serious. And the common food allergens, there's 9 of them: milk, eggs, peanuts, tree nuts, which are different than peanuts. Okay, not the same. Wheat, soy, fin fish, so like regular fishes that swim with their fins, and then shellfish that have their little crustacean bodies, also different, and then sesame. So those are the 9, these are like allergenic foods, okay? So we want to make sure that we're introducing those early so that we try to avoid developing a food allergy. I do want to let you guys know it's very unusual to have a severe allergic reaction the first time you introduce an allergenic food. So rest assured that the very low risk of introducing an allergenic food the first time of having a severe allergic reaction. So don't avoid it because of fear around that, because then we could actually develop an allergy or create an allergy by avoiding those foods. We want to introduce the food early. And the reason is, you guys, it's because we want the immune system of the body to recognize the food as like, hey, you're okay. It's normal to be in here. Not a problem. I see you. I know you're normal, and I don't need to like attack you and go crazy. Okay. If the immune system like never sees that food, it's going to freak out and be like, what are you? Like some kind of like foreign invader that I need to like overreact to and like kill and like cause a severe allergic reaction, right? So we want to introduce early rather than wait, so the body kind of acclimates to that food. Okay. Quick note on what the allergy, will look like. When will it happen? If it does happen, it usually happens within like a few minutes. It can be up to 2 hours. Yes, there's like later reactions, but generally that's kind of what it is. And there'll be like hives, rash, maybe irritation around skin and mouth, nose, gut symptoms, that kind of thing. A severe reaction, that would be, difficulty breathing, changes in lowering in blood pressure, hives with vomiting and diarrhea or diarrhea, itching. Also, if you're seeing like pale or blue skin, if you're seeing any swelling, especially around the neck, throat, tongue, lips, difficulty breathing, skin color changes, anything like that, you're going to want to call 911 right away. If you see a mild reaction, stop the food, talk to your pediatrician. They can let you know how to handle that based on what's going on. Okay. So how do you or what do you even need to know about starting allergenic foods? Okay. So like we said, we want to start early. So, as soon as they're able to sit up and swallow safely in those readiness cues we talked about in the beginning, around 4 to 6 months old. And it doesn't have to be the first food you try, but not the last one either, right? So maybe you've done some squash and some spinach and some sweet potatoes, and now you're like, well, let's give it a little try with peanuts. So, don't put it on the skin, but you can take a little bit on your tip of your finger, just swipe it inside the cheek, see how that goes. Once you've introduced an allergenic food, you do want to stay consistent. Okay, so this is really important. So you don't want to for example, introduce peanut and wait 6 weeks to do it again. Okay, that could be problematic. What you want to do is every week introduce a little bit, 1 or 2 times per week. Just be consistent. So you've introduced peanut, so now we do peanut. We do peanut butter once a week. We do it twice a week, whatever. And then you move on to the next food, and you're going to add sesame or soy or milk, yogurt, kefir, one of those. Okay. Another fun tip is if you are doing an allergenic food, try it in the morning, do it sometime that's earlier in the day. And that way it won't be, a time that you're going to bed, and then you might miss something if there is a little bit of a reaction or allergy that's happening. I get a lot of questions about their sibling is allergic to peanuts. Are they going to be allergic? Should I avoid them? I'm allergic. Should I avoid them? All of that. You don't have to. No, there's no correlation that, one sibling has a food allergy that the other one's going to have it, or the parent has it, that the child's going to have it. That's not a thing. So you don't have to avoid a food because of that. Food mix-in. So a word on this. There's a lot of products on the market that are mix-in powdered products that you can add to food. So you're quote unquote ensuring your baby gets all these food allergens in their diet. They're not that great. It's just better to have the whole food, right? Because you've got all the different proteins, all the different material that's in the food. Everything that your baby could possibly become allergic to is already in that food. So if at all possible, just go ahead and do the whole food. Now, I will say there's probably some times that it could be helpful, like if you're on vacation or like you're just in some like situation where it's like hard to stay consistent with allergy introduction, then you may want to just have it like as a little backup, but nothing that you need to, like do consistently or something like that. It's better to focus on the whole food. Okay, so we have talked about so much today. So we've talked about like when is the baby ready, like how much to eat, what are the key nutrients, what types of foods to do, safe feeding methods, equipment. So, if you enjoyed the episode, go ahead and share it, subscribe, of course, join future discussions. And if you have any questions or, suggestions for episodes, email this to me. I love getting those. And of course, if you are in Asheville or surrounding areas and you would like to join the practice, become a client. I take kiddos 0 to 21 for primary care, holistic primary care. And then again, 2 to 102 for functional medicine consulting. And I think we're going to do a future episode on, who's that really good for. But in general, gut issues, skin issues, fatigue, overweight. Oh my goodness, there's so many things, you guys. Hormonal stuff, rundown, burnout, longevity. But if you need that and you're in North Carolina, South Carolina, or California or Florida, I can do some telehealth with you as well. So again, I'm Dr. Ellie from Middle Path Integrative Pediatrics in Asheville, North Carolina, and I hope this was helpful for you, and I'm wishing you well. Okay, bye.